name is Eva Meyers, nurse practitioner, and I'm here on the beautiful campus of Adventist Health, White Memorial Medical Center in East Los Angeles. Behind us is the Cecilia Gonzalez de la Hoya Cancer Center, and we're inspired every single day to find the best treatments and solutions to treat breast cancer. You'll be hearing today from many of our physicians to talk about breast reconstruction options and challenges. Please know we have very good treatments for breast cancer these days. Most breast cancers are treatable and have very good outcomes. So please work with your doctors and your treatment team so that you can have the best outcomes possible.
We're so pleased to be presenting a topic today around breast reconstruction options and challenges for women that are experiencing treatment for breast cancer. We have an excellent team of experts to join us today. Our first speaker will be Dr. Lee Squitieri, the plastic surgeon. She will be discussing different treatment options for breast reconstruction and how important it is to coordinate with your treatment team. So our purpose today is to give you information that you can go back and have a basic understanding, and then share these options with your treatment team as well as you continue through your journey of cancer treatment. There's so much to learn and so many new experiences, but information is key, and that's our purpose of this video, is to share some key information points with you. Doctor, please introduce yourself and share with us how you ended up being a plastic surgeon briefly, and then different choices and options for breast reconstruction for the woman going through cancer treatment.
Sure.
Thank you for joining us today.
Thanks so much for having me, Eva. It's really great to be here. My name is Lee Squitieri. I'm a plastic and reconstructive surgeon. I'm very passionate about caring for women with breast cancer, and I think it's important for every woman to know that no matter your insurance status, you have a right to receive breast reconstruction after mastectomy. It's part of the Women's Health Cancer Rights Act of 1986.
Perfect, yes.
Yes, and it's something that I'm really passionate about. I became a plastic surgeon because I really love talking to patients and helping them not only, live longer, but have a better quality of life. And that's also really why I like breast reconstruction. Breast reconstruction is a really special process for the patient, and it involves teamwork between the breast cancer surgeon, the nurse practitioners, the family members, the plastic surgeon, the radiation oncologist, and you'll meet everyone from our team later. And in terms of options, breast reconstruction is a really exciting field. It's always evolving. There's always new treatments available. In general, most women either choose to have breast reconstruction that's implant-based, where we insert either an implant directly after mastectomy or a tissue expander to stretch the skin so that the woman can have the size breast that she wants. Or we do what's called autologous reconstruction, where we move tissue around from another part of the body to recreate the natural breast without an implant. It can be done actually with or without an implant, but those are generally the two options.
These days, many of our women are sometimes found to carry high-risk breast cancer genes, and then are eligible for bilateral mastectomy with reconstruction. That's something new even within the last 10 years. And with our treatment team here at Adventist Health White Memorial, that's certainly an option. If you have an 87% chance risk of getting breast cancer, why would we wait for it to come if we could reduce that risk by removing the breast tissue and making it the final outcome look as natural as possible? So that's another role for our breast surgeons and plastic surgeons to work together for the benefit of the woman.
For sure. And I think it's really important for women to know that this genetic testing is available to everybody, and that, when they're getting most women who get diagnosed with this genetic condition and want to have a mastectomy, they tend to be a little bit younger, and it's important for you to know that you too have a right to breast reconstruction, and that we can help you kind of look and feel your best, for the rest of your life.
Some women are concerned about the cost of reconstruction, and if their insurance will pay for it or not. Will you speak to us about that briefly?
Sure, yeah, of course. That's a question we get all the time. And I think it's really important for all women to know that there's a federal law. It's called the Women's Health Cancer Rates Act of 1998. And it mandates that insurance cover breast reconstruction after mastectomy, regardless of your insurance status. So we are here, to help you regardless of your insurance status, just, look and feel your best after making it through cancer.
Do you recommend the woman asked to speak to the plastic surgeon as their cancer treatment journey is beginning, when they're first meeting the medical oncologist and the breast surgeon and their treatment team?
Even if not total mastectomy, I think, breast cancer and breast reconstruction, like we talked about, is a very emotional process. It's very team oriented. And so, every patient should feel like they can talk to any member of the team at any time. And I'm always available. And I think that even if you're not getting a mastectomy where your whole breast is removed, sometimes you just want your breast to be symmetric, a little lifted, match the lumpectomy. And that is also something that a lot of insurance companies also cover. It's called Oncoplastic Reconstruction. And so we do that, and that's really a team-based decision with the breast cancer surgeon. And it's something that, people should know is an option. And really, it's just, we're here for you in the decision-making process. It's not like you just have to come after everything is done.
What if their cancer treatment is ending and almost finished, and they change their mind, or at that stage would like to discuss reconstruction options? Is that a time they can still see you?
Of course. That's a great question too, because there's a lot of women who, prior to the federal law in 1998, did not always have access to reconstruction, and it's never too late. So if you were not able to get reconstruction, or you didn't think you were eligible for it, or you just changed your mind, it's never too late to come in and talk. We can always do what's called delayed reconstruction, which is after your tissues have healed. It might mean that the options available to you are a little bit less, but there are always options for you.
That's good to know. So I like when you said it's never too late for reconstruction consultation related to reconstruction surgery, no matter where you are in the treatment continuum. I know as soon as a woman is first hears that she has a diagnosis of breast cancer, the immediate response is often to let's hurry up and treat, let's hurry up and begin, let's hurry and do surgery right away, or chemotherapy, or whatever your treatment team is suggesting. And sometimes the plastic surgery consultation piece is left out of that initial treatment planning. So I'm happy to hear that it's never too late. It's just a matter of coordinating with your doctors and with your insurance plan to get a consultation and to request. You as the woman going through this journey probably have to request and be insistent about a consultation with a plastic surgeon to see what choices and options you have available. It does make such a big difference when all the whole treatment team know each other and are used to working together, rather than your insurance plan requiring you to go to different hospitals. I've seen breast patients in the treatment continuum crisscrossing the big city of Los Angeles 2 or 3 times before they can even meet their treatment team. And if there's a way for all the doctors that are used to working with each other, know each other, it just does make the process easier when we're planning treatment choices and options.
And I think it's very common. Breast reconstruction, there's a lot of options. Treatment is very treatment often requires a lot of different parts, and they're not always the same for everybody. It's not a one-size-fits-all kind of thing. And so it's really important. I can't even emphasize the importance of being in a team where all the doctors kind of know each other. They know you. It's totally fine if you want to change your mind, or you have a change of heart, or whatever. It's just important that all of your doctors actually communicate with each other very well.
Some insurances are hesitant or have limited resources. I know here in Los Angeles, we're so close to Hollywood that many of the plastic surgeons only take limited insurances. And sometimes your insurance might only have 1 or 2 plastic surgeons available to you. But I think if you insist and request, then certainly they're required by law, as the doctor just said, to provide reconstructive surgery. And it's just a matter of being persistent and making the linkages that are available.
Yeah, and I think that was one of the things that really drew me to want to come to White Memorial. I think, I trained here at LA County in this area in East LA, and I'm, so grateful to this community. And I think I knew that that there was just not a lot of plastic surgeons available for breast reconstruction in this area. And so I really wanted to be able to provide that to people here. And it's been so rewarding. It's just so happy to be here.
And we're so happy to have you. We're so happy that many of our women do now have access to a complete scope of treatment services here at one location. Exactly. We like to call it a one-stop shop, and it makes such a big difference whenever the doctors know each other and are used to working with each other and can help you plan the details of this coordination journey together. So thank you so much for being here, and we're looking forward to wonderful things. One of the first doctors you will meet as part of the treatment team for your breast cancer is the breast surgeon. I'm so pleased to have Dr. Nina Bedhin here today with us to talk about the surgical perspective and how her role fits in with the reconstruction surgery as well. Sometimes it might happen together in the same operating room, but each case is different. Sometimes the reconstruction might happen later on or many months after the initial breast surgery. Either way, Dr. Bedhin is here to share with us as the breast surgeon.
Hi, I'm Dr. Bedhin. I'm a general surgeon at White Memorial. I was trained at Loma Linda University in general surgery. My hopes in joining White Memorial were to provide high-quality breast cancer care to our patients in the underserved Los Angeles area. Part of providing high-quality breast cancer care is having a plastic surgeon available to provide patients with the much-needed reconstruction. There are two options for reconstruction: immediate reconstruction, which is done simultaneously at the time of breast cancer surgery, or delayed reconstruction, which is done after breast cancer surgery. And that option is particularly for patients who may still need to receive additional treatment, such as radiation therapy. We are very happy to welcome Dr. Squitieri to our group, who will be our plastic surgeon and be providing wonderful care for our patients.
I'm so pleased to have Dr. Sheri Marquez, the radiation therapist here in the Cecilia Gonzalez de la Hoya Cancer Center, speak to us and discuss how radiation treatment can vary depending upon the surgical findings. Again, this is very individualized for each patient. So everything we talk about might not apply to you, but you do have to discuss the general issues with your treatment team. Dr. Marquez, tell us more about the role of radiation therapy with breast reconstruction.
Well, thank you, Eva, and welcome all of you to the Cecilia Gonzalez de la Hoya Cancer Center here at Adventist Health White. I am so proud to be part of what we have to offer here. With each and every patient who has breast cancer, we take in all the clinical information, we take in your personal preferences to come up with a treatment plan that works for you. Because not in this field, one shoe doesn't fit everybody. And we take your pathology findings, what is important to you, whether reconstruction is part of your plan, and the extent of disease, most importantly, in order to determine the best plan. For some cancers, you may not need radiation. However, for others, you often do, especially if either you want to keep your breast or you've had a mastectomy. A lot of times the reasons for mastectomy might include that you have more advanced disease, and radiation may play a role in improving your outcomes. When that happens and someone's interested in reconstruction, we work very closely with all of your surgical teams in order to determine the timing of radiation as well as the delivery of radiation. Behind me is a linear accelerator, which is our main delivery system. We use this to focus the radiation on where it needs to be. We're very lucky. Our machine is very young, and we have all the bells and whistles to protect the capsules of any implant reconstruction efforts to minimize the risk of contracture, which can be a problem after radiation therapy in a patient who does want reconstruction. Some patients prefer to hold off on reconstruction until after radiation, and they work with their plastic surgeon to get what's called an expander. So it stretches the tissues to prepare for the final implant. Radiation is also carefully delivered in that scenario to protect the equipment and the future plans to switch it out for a permanent implant. This is important because number one priority is getting you cured. However, we want to get you back to a sense of normalcy, and cosmetic outcome is part of that. And we want to attend to your needs when it comes to those issues. Thank you.